Welcome back to the Deep Dive. We're coming at you with another episode that, no exaggeration, is going to fundamentally change the way you think about your body, your health, and frankly, the entire medical system. Jamie, I feel like we say that a lot, but this one hits different.
Oh, Alex, you are not wrong. Today, we're tearing down the walls between what we perceive as separate diseases and showing you the incredible, almost mind-bending truth that connects them all. We're talking about good energy and the shocking consequences of when our bodies run on bad energy.
Good energy, bad energy, it sounds like something out of a superhero movie, but you're telling me this is actual hardcore medical science? Because if it is, I'm ready to have my mind blown. Again.
Get ready, because it absolutely is. We're going to dive into the work of Dr. Casey Means, a former surgical resident who literally walked away from a highly prestigious, multi-six-figure surgical career because she saw a fundamental flaw, a huge, gaping hole in how we approach health.
Wait, hold on. She just quit? Like years into residency? That's insane. What could possibly make someone do that?
It's a powerful story, Alex, and it starts with her own mother. Her mom weighed nearly 12 pounds at birth, which, as Dr. Means points out, was already a sign of energy dysfunction, probably undiagnosed gestational diabetes in her mother. Fast forward to her mom's 40s, elevated blood pressure, prescribed an ACE inhibitor. 50s, high cholesterol, prescribed a statin. 60s, prediabetes, prescribed metformin.
So, one drug after another for what seemed like separate age-related issues. That sounds terrifyingly normal for a lot of people I know.
Exactly. And her doctors were complimenting her, telling her she was healthy for her age, despite seeing 5 separate specialists and taking 5 different medications. Then, at 71, she's diagnosed with stage 4 pancreatic cancer. 13 days later, she was gone.
13 days. That's heartbreaking. But also, it makes you wonder, if she was seeing all these specialists, taking all these meds, how did it go from healthy for her age to stage 4 cancer in a blink?
And that's the core question Dr. Means asked, the one that ignited her quest. She realized that all those seemingly isolated conditions, the big baby, the high blood pressure, the cholesterol, the prediabetes, weren't isolated at all. They were all warning signs, flashing lights of the same thing, a fundamental dysregulation in how her cells were producing and using energy.
So you're saying it wasn't just bad luck, like the oncologists at Stanford told her, it was all connected?
Precisely. And this is where the big lie in healthcare comes in. We're told that the root cause of why we're sicker, heavier, more depressed, more infertile, why everything is going downhill, is complicated. But Dr. Means argues that's simply not true. The root cause is far simpler, and it's something we have immense control over.
The big lie. Okay, now you've got my full attention. Because yeah, it always feels like this super complex puzzle, right? You've got your heart doctor, your brain doctor, your gut doctor, and they're all in their own silos.
And that's part of the problem. Think about it. Virtually no animals in the wild suffer from widespread chronic disease. You don't see rampant obesity, heart disease, or type 2 diabetes rates among lions or giraffes. Why? Because they're living in sync with their evolutionary environment. Humans, on the other hand, 80% of modern human deaths are from preventable lifestyle conditions.
So we're the only species that's basically poisoning itself out of existence? That's a stark comparison. No wonder Dr. Means got frustrated with the system.
It's an evolutionary mismatch, Alex. Our bodies evolved over hundreds of thousands of years in a synergistic relationship with our environment. But in recent decades, things have profoundly and rapidly changed. Our diet, our movement patterns, our sleep, our stress levels, our exposure to non-natural chemicals, our cells are now in an environment radically different from what they expect and need.
And that's what creates bad energy? Like our cells are trying to run a marathon on a diet of soda and chips?
That's a fantastic analogy, Alex. When those cellular mechanisms that transform food into energy, that create what Dr. Means calls good energy, aren't working well, that's bad energy, or metabolic dysfunction. It's not just about feeling tired. It ripples up into every tissue, organ, and system in your body. It influences how you feel, think, function, look, age, and even how well you fight off illness.
So all those annoying, seemingly unrelated issues, fatigue, brain fog, anxiety, arthritis, infertility, erectile dysfunction, those aren't just getting older or just the way it is. They're all connected to this bad energy thing.
Ding, ding, ding. Exactly. Dr. Means says these are all signs of bad energy brewing inside your body. And if you ignore those minor issues, you could get much louder signals in the future, like her mother.
That's stinging information, but also incredibly motivating because it means we actually have a shot at preventing the bigger stuff down the line. But how does bad energy show up differently? Like, if it's the same root cause, why do some people get migraines and others get heart disease?
Great question. It depends on which cells are most affected and where. For instance, if an ovarian cell is experiencing bad energy, it can look like infertility, specifically polycystic ovary syndrome, PCOS. If it's a blood vessel lining cell, you might see erectile dysfunction, heart disease, high blood pressure, or kidney disease. If it's liver cells, non-alcoholic fatty liver disease. In the brain, depression, stroke, dementia, migraines, chronic pain.
Whoa, so literally all these completely different diagnoses, different specialists, different drugs, all linked to the same underlying cellular energy problem? That's a massive paradigm shift. It makes so much sense why Dr. Means had to walk away from conventional medicine.
It really does. She tells the story of Sophia, a 52-year-old woman plagued by recurrent sinus infections, missing work, losing sleep, overweight, pre-diabetic, high blood pressure, back pain, depression. She was seeing a different doctor for each issue, getting a separate treatment plan.
Oh man, the poster child for siloed medicine right there.
Exactly. Sophia came to Dr. Means, who was a surgical resident, for sinus surgery. And Dr. Means performed the surgery, breaking up bones, vacuuming out tissue. Sophia even said, "You saved me." But Dr. Means felt defeated. She knew she'd only relieved the downstream symptoms of inflammation. She hadn't cured the underlying cause, nor helped with any of Sophia's other conditions.
So she fixed the nose, but the body was still broken. That's a tough realization for a surgeon, I imagine.
It was a huge turning point. She realized she was an inflammation physician, constantly treating sinusitis, tonsillitis, pharyngitis, all the itises, without ever being taught what causes the inflammation in the first place, or its connection to the other chronic diseases she saw returning patients with.
The suffix itis means inflammation. I never even put that together. So she was literally a specialist in inflammation, but not in its origin.
Precisely. And that's the tragedy of our highly specialized medical system. In medical school, she had to choose one of 42 specialties. She funneled from broad biology to human biology, then to the head and neck, then to otology, 3 tiny square inches around the ear. She could have become a rhinologist, a laryngologist, an otologist focused on 3 bones.
That's like focusing on one tiny cog in a massive machine and ignoring the engine itself. It sounds inefficient at best and potentially dangerous at worst.
It leaves patients like Sarah in a labyrinth. Sarah was 36, gripped with intractable migraines, largely housebound, inflammatory arthritis, depression, hypertension. She'd seen 8 specialists in a year, taking meds for everything. And when Dr. Means asked if she'd tried a migraine elimination diet, Sarah balked. She thought, if food could have helped, they would have told me long ago.
So what was the connection for Sarah?
Dr. Means looked at Sarah's labs and saw high inflammatory markers, and she started asking, could inflammation have a role in causing migraines? A quick search revealed over 1,000 scientific papers connecting the two. So Sarah's migraines, her arthritis, her depression, all potentially rooted in chronic inflammation.
Mind blown. So inflammation isn't just about a swollen ankle, it's this invisible systemic fire that's burning throughout the body, causing all these different problems.
That's right. And here's the kicker. This chronic inflammation is often a response to our body's cells feeling threatened because they are persistently underpowered due to bad energy processes. Your cells are sending out chemical alarm signals, recruiting the immune system to help. And in doing so, the immune cells cause immense collateral damage. It's like a literal war within the body, protecting itself from itself.
So the inflammation itself is a symptom of the bad energy? It's not the ultimate root cause?
Exactly. It's one layer deeper. And the deepest layer, the fundamental powerhouse where good energy is made or lost, is in our mitochondria. You probably remember them from high school biology, right?
The powerhouse of the cell. That much I remember. But I don't think I've thought about them since. What's the big deal?
They are the ultimate big deal. Mitochondria are tiny organelles inside every single one of your cells. Their job is to take the breakdown products of the food we eat, fatty acids from fats, glucose from carbohydrates, and convert it into the energy currency our cells use, adenosine transferase, or ATP.
ATP, right. I remember that acronym. So they're like little cellular power plants?
Perfect analogy. And different cells have different numbers of them. A liver cell, super active, might have hundreds of thousands. A skin cell, maybe fewer. But every